An experience that can turn an unbeliever in the existence or extent of the disease into an evangelist of its reality. I spoke to a nurse at the KNH National Hospital Infectious Disease Unit's Intensive Care Unit just to get a sense of what's like for a frontliner.
We are taking care of patients who have COVID-19 disease or who are suspected of COVID-19 disease. There is the fear of what if one gets infected, what if in the event of providing care for the patients, I also get infected. When we arrive, we change into the appropriate uniform, and then we take the patient's report, and then we plan for the patient's care as based on the report that we have. Twice I have had a cough, and that was very scaring. I went for testing, and after a day I had the results which tested negative, and that now allayed my fears. But obviously every time you have a symptom that is COVID-like, then you also get worried a bit. The initial phases were very low moments for my children especially, because I remember one of the first weekends we had was after the news about the positive patient. Then all of us were fearful that we may have been infected.
Yes.
And so conversations were more of, just in case I get infected, then I'll have to go for isolation, quarantine, and that is something they had to start getting used to. I also had to let them know that in case I am away, then the family needs to run. And that is now a conversation with my husband. I'm married. And things need to go on as normal.
Have you ever lost a patient, unfortunately?
Well, sadly, yes. As we speak, we are at the COVID ICU. And we have lost patients. And it is not a very good experience. When I am away from my workplace, I find time to unwind with the family, especially nature walk. I love nature.
Have you had successful recoveries?
Oh yes, I think the successful recoveries are many from our statistics. I'm not sure we can tell the end. What I'm sure of is COVID is here, and we all are doing our best in responding at different levels, for us as frontline health workers, but for the rest of the population, following the Ministry of Health guidelines. That is how we together can actually overcome COVID. Very important is my spiritual foundation. It lays the basis. I kind of have a guarantee that I am getting into caring for patients with COVID, not alone. God is with me and with the team.
It was a tough one, I must admit.